Hi, my name is Dr. Jaunbocus. I'm a GP in the UK. I would like to talk to you about atorvastatin. We will look at what is atorvastatin and why is it being prescribed, who can and who can't take atorvastatin, how you should take your medication, the potential side effects with atorvastatin, and the possible interactions with other medication you may be taking. So, what is atorvastatin? Atorvastatin is one of the most commonly prescribed medications. It belongs to a group of medication known as statins. Statins are used to help better control your cholesterol level, which can reduce your risk of heart and blood vessel disease, such as heart attack and strokes. Statins act on the liver, reducing the amount of cholesterol your body makes. So, who can take atorvastatin? You may have been prescribed atorvastatin where your doctor has identified that your blood cholesterol levels are too high in your body. In order to prevent heart disease such as heart attacks and stroke, this may be for patients with a family history of heart disease and also patients with other medical conditions such as diabetes or rheumatoid arthritis. You may have been prescribed this medication under its generic name of atorvastatin or a branded name such as Lipitor. So now we're going to talk about patients who may not be suitable for atorvastatin. Atorvastatin isn't suitable for all patients. This is a decision that should be made by your GP. Your doctor should be aware if you may be pregnant or you're currently breastfeeding, have experienced any allergic reaction to any statins in the past, such as simvastatin or rosuvastatin. If you suffer from underactive thyroid, which have not already been treated, liver disease and patients who have a high alcohol consumption, patients with personal or family history of muscular disorders, history of a stroke caused by a bleed to the brain. Patients with kidney disease may require a smaller starting dose. So, how should you be taking your medication? Your doctor will decide on what dose is suitable for you, and this may change depending on how well the medication works for you. Usually, atorvastatin is taken once a day with doses ranging from a 10 mg to an 80 mg. If you forget to take your daily dose, wait until the following day when your next dose is due. Do not double up your medication. Statins usually take around 4 weeks to cause a noticeable drop in your cholesterol level. After 3 months, your doctor might want to organize a blood test to monitor your cholesterol level and also your liver function test. Most people will continue taking atorvastatin lifelong. This is because the beneficial effect will wear off. So, what are the side effects of atorvastatin? As with all medications, they have the potential to affect different people in different ways. It is important to realize that most patients taking statins do not experience any side effects. So let's talk about the common side effects experienced by patients. Some of them are lack of energy, gastrointestinal side effects such as nausea, constipation and diarrhea, excess flatulence and gastrointestinal discomfort, dizziness and headache, muscle ache, sleep disturbance, and a medical term called thrombocytopenia, which is reduction in the level of platelets that may prolong the time it takes for you to stop any bleeding. The other uncommon side effects that some patients may experience are hair loss, liver disturbance and inflammation of the pancreas, poor memory, altered sensation, skin reactions and vomiting. Now let's talk about the rare side effects that some people may experience. So these are allergic reaction to atorvastatin, muscle aching, weakness or cramping, numbness to the peripheries, pain and swelling of the tendons. Of unknown incidents, A statin may cause or potentially worsen diabetes and can also cause depression. If you experience any of the listed side effects as above, it's a good idea to discuss this with your GP. You should stop taking atorvastatin and contact your doctor urgently where you experience the following side effects: muscle aching, weakening, or cramping. This may indicate muscle breakdown or that the medication is affecting the kidneys. Yellowing of the skin and eyes can indicate the medication is affecting your liver. Some patients may also notice lighter colouring to their poo and darker wheeze. Severe abdominal pain may be an indication of inflammation of the pancreas, also known as pancreatitis. If you develop a cough, breathlessness, this may indicate the medication is having a negative effect on your lungs, which may result in a condition called interstitial lung disease. An itchy hive like rash, facial swelling, or difficulty in breathing may indicate an allergic reaction. In these circumstances, you must seek urgent medical assessment. So let's talk about the interaction with other medications. Your doctor will also need to review your other medication when commencing on atorvastatin. Certain medications have the potential for increasing the likelihood of side effects or influence how well your medication is working. So you should consult with your doctor if you're taking any of the following: antibiotic or antifungal medications, warfarin, which is commonly used to reducing your risk of blood clot, certain blood pressure medication, and some medications used to control your heart rate, such as amiodarone. The oral contraceptive pill, statin, may increase the effect of these contraceptive medication, increasing the lady's risk of side effect. Immunosuppressive medication, commonly used for rheumatological conditions such as cyclosporin. Colchicine, a medication to prevent flare-up of gout. Medications which may be used to treat blood-borne infections such as HIV and hepatitis C. So, it is still safe to consume alcohol while taking atorvastatin. However, it is recommended to stay within the national recommendation of alcohol consumption. When used in moderation, this should not result in any detrimental effect. So, thank you for watching. We hope you have found this information useful. If you have enjoyed this video, why not subscribe, click the bell, or write a comment below. Of course, this video does not provide medical advice and it is intended for informational purposes only. Do not consider this as a substitute for professional medical advice, diagnosis, or treatment. Don't ignore professional medical advice in seeking treatment because of something you have heard here. If you believe you may have a medical emergency, immediately call your doctor or the ambulance services.